Hi, welcome to the Dog Dave Show. I'm pleased you've joined us today. It is always a pleasure having you as viewing our shows, and every day we try to, or every week we try to bring you something different. Now, on this show today, we are talking about something very exciting. Nearly everybody gets some kind of pain, and we're talking about pain today. And in the studio today to talk about pain is Georgia. Georgia Reid.
Thank you.
Thank you so much for coming to see us.
Lovely. Thanks for having me.
Yeah, so difficult to find. At last I got to pin you down.
Yes.
And it's always a pleasure having somebody to come to the show. We appreciate that.
Thank you for having me.
Now, Georgia, you are an occupational therapist, right?
Correct, yes. I'm an occupational therapist.
That's right. And you're trained in Australia?
Yes, so I went to JCU in Townsville, and I been an occupational therapist for 4.5 years.
Right. Okay.
Yeah.
What made you drive into occupational therapy courses?
It was something that I came to in my later 20s, and it was something that I didn't know much about, but learnt that I really was quite passionate about occupational therapy. Yeah, and then I got into hand therapy about 3.5 years ago, and I absolutely love it.
Love it.
Yeah, that's where I've sort of learnt about Interx and where I've come across it.
Yes,
Yeah.
and you told me earlier on that before occupational therapy, you did interior design as well?
I did, yeah. So I started
That's a big jump.
Yeah, very different. So I started interior design in Melbourne, and wasn't really the sort of thing that I was into in the long term.
Yes.
And then I've made quite a different career choice in becoming an occupational therapist.
Yes, and you said this was through experience through a family member who was unwell?
Yeah, so both my parents have hand conditions, so base of thumb arthritis and a wrist fracture and something called Dupuytren's contracture.
Yes.
And I was then able to see my parents' journey sort of getting through with some hand therapy, and I realised that's what I wanted to do as well.
Yeah, that's good. Yeah. And you're so passionate about hand therapy in particular.
Yes, right. Very much so.
Yeah. So in broad terms, anyway, occupational therapy, I know, you help us with improving functionality of people who've got different conditions.
Correct.
But I didn't know that there's subspecialties. After doing occupational therapy, you can specialize in something. Yeah. Like for instance yourself, you did hand therapy. Tell us more about it.
So once you've become an occupational therapist, you do a 4-year degree, and then you can choose to specialise in a particular area, whether it's aged care or mental health or working in a hospital. So hand therapy then is something that you specialise in after you've done your degree. You end up doing about 3 years full-time work and a number of hand therapy courses, and then you can progress on to do 12 months of mentorship before you can become an accredited hand therapist. So that's the path I'm on at the moment, so hoping to become an accredited hand therapist.
Do you have to sit exams as well?
There will be, some exams and assignments along the way as well.
Right.
Yeah.
It never ends, isn't it?
Never ends.
That's why. Well, that's what you want to do, isn't it?
Absolutely.
That's
fantastic. And then we become very specialised, so it's a privilege to become a hand therapist.
Right, okay. And you were telling me that you have to do all the detailed anatomy of the hand.
Absolutely.
And you got the knowledge just as much like an orthopedic surgeon knows.
Just about.
And surgeons.
Yeah.
So you know all the details stuff. Which is where the Interx now, the therapy you're going to talk about on the show now, comes in, because there's this therapy, you said it's been going on since in the 1950s. Yeah. It gradually progressed over the years. Tell us more about this Interx.
So Interx is a form of non-invasive neurostimulation. It's a little bit like a TENS machine. That's probably the best way to describe it to someone who doesn't know what Interx is. And it uses electricity to stimulate cells in the body, and we can use it to help reduce pain and reduce swelling, and it's very good for improving range of motion in a joint as well.
Right, okay. So you're working at the cellular level, you're saying. So you're trying to change the way the cells work, is that right?
Yeah, so we're trying to get the cells to function at their best. So every cell in the body has a certain amount of electricity in it, and unhealthy cells come about from injury or disease. So we're using the Interex to firstly find where those unhealthy cells are, and then top up their electricity levels so that they're working their best. It's a little bit like having a full battery in your phone or your car.
Yes. So you're going to show us here how to use the gadget, which is very exciting, I think.
Yes.
So going back to the Interex, and it has been ongoing for years, and you said again it was an invention or intervention that started in Russia, that's correct?
Yeah, it's something that is quite widely used in Europe. In Russia they use it in emergency departments to help patients with pain, and they're using it a lot in the US and the UK as well for pain management and for a variety of conditions.
And in Australia, you say this is a new thing?
It's I don't know exactly when it came to Australia, but it is relatively new. We are a little bit behind the US and the UK, but now we have it here in Australia. So
and a few occupational therapists are doing that now.
Yeah, we've certainly got there's therapists in Sydney, Brisbane, Melbourne, Adelaide, and Perth. Many other places all around Australia are starting to use it.
And in the northern part of Queensland, you happen to be the only one, right?
We are the specialists in the use of Interex therapy in North Queensland.
That's right. Tell us about the special conditions you find very much relieved in terms of pain using this gadget.
There's really no limits as to what conditions we can use Interex for. So it might be as simple as a sprained finger, but we can use it for shoulder pain or frozen shoulder. We can use it for back pain. We can even use it for things like period pain and headaches. We can use it for chronic regional pain syndrome and those more complex syndromes, and we can also use it for more mild mental health symptoms as well, helping with sleep and anxiety and depression as well.
That's very exciting when it comes to anxiety.
Yeah, it has been very exciting.
Very exciting. So what particularly are you looking at in anxiety or poor sleep, for instance?
Okay, so when someone is anxious or sleeping poorly, often they're feeling a bit overwhelmed or their mind is racing. So we're trying to switch off that cycle, change that cycle so that they're then able to sleep better. So we're working with trigger points in the body to help stimulate these areas that will help to bring them into a more calmer state, so then they're able to sleep better and heal their body better and have more energy.
So they come to your practice, you do the treatment, and they go home and the sleep gets better, right?
Yeah, so sometimes initially the body's a bit unsure of what's just happened. It's trying to process the electricity. So sometimes initially they might feel worse for 1 or 2 appointments, and then their body starts to get better. So they start to have less pain, or their sleep starts to improve.
Do they feel anything?
They do, yeah. It feels like pins and needles, so it's very comfortable feeling. It should never be uncomfortable, and that's something that's really important during the treatment, is that they feel very comfortable with what they're feeling on their skin. Yeah.
Is there any particular demography in terms of patient presentations? Do you see more of the younger ones or more of the older kind of patients?
No, it really can be used for anyone. We can use it on children, adults and older people as well. Interestingly, you can use it on animals as well. So there are therapists who use it for horses and for dogs as well.
Oh my goodness, man.
So it's really quite a diverse device.
Yeah, that it is. It's very exciting, right? So following in with your specialty, Interex, where do you see yourself going with this?
I'm hoping that we're able to reach more of North Queensland residents and able to show them what we can do and be able to give them a pain-free way of living, or at least reducing their pain. because there's no major side effects. You don't need to have medication while you're using it, and in fact some patients have then been able to come off pain medication because they no longer need it. We'd like to just be able to get out and use it more and treat more patients.
That's right. And you work alongside other therapists, for instance, exercise physiologists and massage therapists. And,
that would be something that we'd love to do more of. At the moment, we are a team of occupational therapists and physiotherapists, but I think there would be scope to work together and as a team.
Yes, that's fine. That's fantastic. Okay, Georgia, you can take us through the Interact. That's the device you're holding in your hand there?
Yeah, so it's only quite small, which I think people are surprised about. It has a metal plate on one side, and that's what we use to actually detect the energy levels in the skin.
Okay.
And then the device front here will tell us the electricity levels in the skin, so it gives us a reading, and then we can use the buttons to toggle around. Then it depends on what area of the body you're treating, because then you can either use the device itself sort of on a hand or a shoulder or whatever it is that you're treating, or you can attach another attachment which might be good for, say, using on a back or a leg or a knee, and it comes with a whole variety. So we have one that's very good for hair, so we actually treat through the scalp, so that just gets around the hair problem. And another attachment, for example, we can use to really massage into the muscles as well. So it's not just the stimulation, but also sort of adding in that traditional rehab of massage as well. So
I'd like to take you back to where you said there's a reading. You have to read the reading of the electricity there.
Yeah, that's right.
So you go according to the level of the certain number that comes up?
Yeah, so there's a few questions that we'll ask a patient when they come in. So we're first asking them what their pain levels are. We're also asking them how long they've had their injury for. So whether it's more short term, like less than 4 weeks, or chronic, which would be more than 4 weeks. And then that then helps me to tell which of the settings to use. For example, if someone had tendinitis in their arm and they'd had it for 4 weeks, I'd use a chronic setting, and then I can choose the pulses that go through the skin. So then I'm able to place it on the skin. We can see the electricity reading through there. It will, and then we can treat the area that we need to treat after we've scanned the entire area.
Let's say that particular area you want to treat is swollen, for instance. Would you get a higher or lower reading?
You would get a higher reading. So it's telling me how much electricity the body's absorbed. So we're looking for high numbers as opposed to low numbers.
So high numbers means there's a disease there.
Or the cells aren't functioning at their best. Yes,
that's fine. Okay, and you can put this on the head anyway. You can use it.
I
can see you got some more things there.
You can really use it on most parts of the body. There are some conditions that we can't treat, so we wouldn't treat over a cancer or a tumor, for example, but we could treat away from it. So if, for example, someone had breast cancer, we could still treat the arm, we just wouldn't treat directly over the breast itself. We don't treat people who are pregnant either, and we always check to make sure that they don't have any heart conditions and they don't have epilepsy or seizures, in case we might bring on their condition as well.
Those are the contraindications.
We can still proceed with caution with patients with cancer or epilepsy, but we just apply caution. Pregnancy we definitely don't treat, and if they have any electronics in their body such as a pacemaker, we also don't treat them as well.
Okay. For instance, it's, how many sessions would somebody need? Let's say rheumatoid arthritis, for instance, with the hands.
It's difficult to gauge sometimes because some patients have a lot of pain or they've been unwell for a long time. So sometimes we might be able to treat them for 6 sessions. Sometimes it might be more like over a period of 6 months or 12 months. So it really does depend on the individual.
Can people just buy it off the internet, for instance?
Unfortunately, at this stage, no. You would need a prescription to buy it. So once you'd had your initial consultation with me or another Interrex therapist, you are then able to purchase it online.
Yes.
Or the other option is that you could hire the devices as well. So if you needed to use it for 2 months, for example, you could hire it for that period and use it at home.
So when it's part of your prescription, you're making up the settings. You recommend some settings.
I would go through with the patient what settings to use, how to use it, how to turn it on and off, clean it, sort of the works. So it's all part of what you get in your appointment.
Yeah, you don't want just to buy something, just start to use it. You might not see the good results anywhere, so it's always good to be guided. I've been looking at the reviews about Interrex, thousands of them. Yeah, there's good reports about this gadget. It does work.
Absolutely.
According to the reviews of going through. As usual, we always put a disclaimer. We should have done that first. We're not promoting any product, right? And Georgia is here to talk about Interrex from her own clinical experience. Yeah. So we always say at the outset, if you've got any problem, pain, situation, something bothering you, poor quality of life because of sleep, always talk to your healthcare provider, your family physician or a nurse.
Absolutely.
Before you talk to, hand therapists for opinion. We always say go to your healthcare provider and talk about it, and they'll make you the treatment for you and line you up with Georgia or the hand therapy team in Townsville. Correct. And you are the only ones here in Townsville, correct?
As far as I'm aware, we're the only people in Townsville.
Yeah, and forever busy, obviously.
Always.
Yeah, it was 30%, 40%, as we say, of my patients I see, they come with some kind of pain. It doesn't matter young or old. It is quite an issue. It's quite painful to treat pain.
A lot of people experience pain, and it can be very debilitating.
Yeah, it can be,
and that's why Interrex is so wonderful, because we're able to take pain away for those patients.
That's good, yeah. Overall, what we need is a quality of life, isn't it?
Absolutely.
And come off the medication, like you said earlier on. If you come off of these nasty medications and go for these non-invasive procedures, so be it. If it's working for you, that's fantastic.
Absolutely.
It's very much to be encouraged, isn't it? So. Right, so you are contactable, you are available.
Yes.
We'll put your details on the website. And,
absolutely, we're happy to see any patients, even if they just wanted to discuss the treatment to see if it's right for you. We'd be more than happy to have you in at Helping Hands.
Yeah, that's fantastic. And there you are. So that's Georgie Reid, occupational therapist with a passion in Interrex therapy. I think it's a wonderful thing. I really advocate for anything that helps people relieve pain and improve their quality of life.
Yeah, absolutely.
Thank you for what you're doing, and wish you the best in your career as a Interrex therapist, will you be?
Thank you. I suppose you could call me that. Yeah, Interrex therapist. Yeah.
That's right. Yeah. Anything you want to tell the viewers?
Anything that you wanted to discuss with Helping Hands, feel free to give us a call. You can ask to speak to myself or Cassandra, and we'll be looking forward to hearing from you.
That's right. So, thank you so much for joining us on the Dog Day Show. As usual, we say keep well, keep safe, and God bless you. Bye-bye for now.